Yes, we have presented the results of one study that combined these two treatment options. And we know that radical cystectomy is the standard of care for patients with muscle-invasive bladder cancer, but there are preserving alternatives that are used when the patients are ineligible for cisplatin or for chemotherapy, but also for those patients who wish to preserve their bladder. On one hand, we know that atezolizumab is an anti-PD-L1 systemic treatment that have demonstrated activity in metastatic bladder cancer. And on the other hand, we know that radiation therapy induces immune responses, local and systemic immune responses. So that's the rationale for combining immunotherapy with radiation therapy in urothelial carcinoma. Well, first I want to highlight that these are the results of a preliminary analysis of this study. So we have to wait until the final results. It's certain that the results are good because we evaluate this population that have been evaluated in this interim analysis, and the results are good because the percentage of responses is good. It's better than another studies that have been analyzed this strategy, the preserving strategy. But on the other side, we have to wait until the final results to look at the efficacy and the long-term safety. But I think we are going on the right direction. On the other hand, we know that most of the patients are T2N0M0 patients, and that we evaluate pathologic complete response based on Miller and Pain grade 5 criteria. Well, we have seen, in my opinion, a good tolerance, but the most frequent side effects have been asthenia, dysuria, and diarrhea as most frequent side effects. Okay, I think the results are good in terms of toxicity, but we must remember that both immunotherapy and radiation therapy can potentially have side effects. So we have to be careful with toxicity by identifying and treating early these toxicities. I think this is very important when we do an preserving treatment in patients with bladder cancer that are old patients with comorbidities. We are evaluating a population where we have very limited options. So with the results, I think we are opening the door for a new strategy that must be evaluated in prospective clinical trials, but can be an active and well-tolerated option. So the results are good, but we have to wait until final results in terms of pathologic response, but also in terms of disease-free survival and overall survival. And also, we need to look for long-term toxicity side effects of this combination. And of course, finally, I have to say that we need randomized clinical trials with this combination compared to traditional combining preservative strategies.